Hello everyone, this is Dr. Tidman. Thank you for viewing my YouTube channel and for watching this brief research review entitled Modulation of Gut Microbiota Through Dietary Interventions in Neuroinflammation and Alzheimer's and Parkinson's Disease. This article was written by Aiton and Bilici in 2024. My goal for these research reviews is to review the elements of a research article in Parkinson's disease and to then make application recommendations for how you could use this information in your daily life. Please like, subscribe, and hit the notification bell so that you'll be informed of future presentations that I'll post on my YouTube channel. Once again, thank you for viewing this presentation. My objectives for this presentation are to review the main topic investigated in the article, to review briefly the role of the gut microbiome, and if you want to know more about that topic, view another video on my YouTube channel where I talk about probiotics and the gut microbiome. I go into quite a bit of detail there on the functions of the gut microbiome. I'm going to review briefly the dietary interventions and effects on the microbiome that were covered in this article. These dietary interventions will include a low-carb ketogenic diet, a Mediterranean diet, a vegetarian diet, a high-carb, low-protein diet, and a standard American or Western diet. The authors in this case reviewed 17 studies that investigated different dietary interventions. I'm going to discuss how the gut microbiome creates neurochemicals and neurotransmitters described in the article. These are important for brain function. The authors attempted to connect neuroinflammation to cognition and motor functions, especially in Parkinson's and other neurodegenerative diseases. And then finally, I'm going to discuss some practical applications for daily lifestyle strategies to maintain both gut health and brain health. So the authors conducted a comprehensive review of 17 studies. These studies were all investigating dietary influences on gut microbiota and results in the production of neurochemicals for brain function. The 17 studies reviewed were published between 2013 and 2023. Of course, the focus of this talk is going to be mostly on Parkinson's disease and the dietary approaches that they investigated. The study article itself investigated several neurodegenerative diseases. I will link to the study article itself in the description for this video so you can read and review that article yourself. So the authors found in their review that constipation affects over 61% of all persons with Parkinson's. They also found that in 24% of cases, patients had bowel problems years before they developed symptoms of Parkinson's. There also appears to be a higher incidence of Parkinson's in patients with irritable bowel syndrome and other bowel abnormalities. Leaky gut symptoms contributes to total body and brain inflammation and is often seen in patients with Parkinson's. Gut inflammation can also be linked to the motor symptoms in Parkinson's. The presence of overgrowth of abnormal amounts of inflammatory microbes are also seen in Parkinson's, and often the researchers see an absence of anti-inflammatory microbes in the gut. So all of these things seem to be influencing symptoms of Parkinson's and were found in the 17 studies the authors reviewed. So first, the authors briefly reviewed studies that investigated a vegetarian diet and its effects on Parkinson's. Initially, they found in these studies vegetarian diets provide some beneficial microbes and may reduce gut inflammation up to 1 year. The biodiversity of the microbiota in the gut was also improved on a vegetarian diet, but these results were not sustained after 1 year. Some of the studies they reviewed also indicated some benefit for the reduction of the dosage of L-DOPA medications. Another diet reviewed in the studies was a high-carb, low-protein diet. Some benefits were seen in some of these studies in dopamine production in the gut and central nervous system, but these changes were not sustainable. They also found that increased bile acids with neuroprotective effects occurred in this dietary approach with the production of certain amino acids and taurine, which are known to be anti-inflammatory. They also found that some studies indicated there were transient or short-term benefits to motor symptoms in Parkinson's. We know that protein can be a problem in its interaction with your L-DOPA medications. But oftentimes, it's not necessarily the amount of protein you're eating, but the timing of the protein and the medications. Another set of studies they reviewed investigated the Mediterranean diet in Parkinson's disease. Some of these studies found that after 5 weeks, constipation improved. They also indicated some reduction in inflammatory microbes. But there was no improvement in the symptoms of leaky gut in the studies that they reviewed. Their conclusions were that a Mediterranean diet can potentially improve gut function and thus function in the central nervous system through the gut-brain axis, and the neurochemicals that are manufactured in the gut and travel to the brain can be enhanced with this diet. Mediterranean diets are typically very high in olive oil, which is a good healthy fat. They investigated studies that researched the Western or standard American diet and symptoms of Parkinson's, but some of these studies were in mouse models. So we know that there's a lack of human trials. They found that diets that are high carb plus high fat plus high processed foods with a large amount of fructose are associated with neuroinflammation. This diet also leads to leaky gut symptoms and problems with the gut lining. And we know that with increased permeability or damage to the gut lining, microbes that shouldn't be in the bloodstream leak into the bloodstream, causing problems in other areas of the body. They also found studies that said this diet, the standard American or Western diet, promotes the presence or overgrowth of gram-negative bacteria, which can have negative effects. This overgrowth leads to an increase in neuroinflammation and the formation of some of these abnormal proteins that we find in the brain in Parkinson's. They further found that this diet can be associated with decline in cognition in both Alzheimer's and Parkinson's, and that typically this diet is lower in fiber, which can lead to dysbiosis in the gut or the proliferation of abnormal microbes in the gut. So finally, they reviewed the effects of a ketogenic diet in some studies and showed that these studies revealed that the ketogenic diet can reduce cognitive impairment in Parkinson's. Ketogenic diets mimic fasting, which lowers glucose and raises blood ketones. We know through other research studies that ketones have been shown to benefit brain energy and neuroprotection. There's also some benefits in some of the studies they reviewed to vascular functions in the brain. Ketones can increase beneficial microbes, reduce gut inflammation and symptoms of leaky gut through the production of something called butyrate. And we're familiar with beta-hydroxybutyrate, which is the blood ketone molecule that is used to influence brain function. We know that butyrate also reduces inflammation and the presence of inflammatory microbes. Ketones have some effect on the symptoms of Parkinson's, including motor and tremor. A ketogenic diet with the inclusion of more fish and olive oil can benefit gut health. And the authors said that a ketogenic diet is sometimes hard to sustain, so they suggested through their review of some studies that a modified Atkins diet may be more sustainable, which is basically a ketogenic diet with a little bit higher carbohydrate intake. So the authors' conclusions were that maintaining a balance in the microbes for a healthy gut can have profound effects on Alzheimer's, Parkinson's, and cognitive function. They also found in their review that nutrition can mediate neuroinflammation. Some of the studies they reviewed said that high-fat, high-carb, high-fructose diets, which are commonly called standard American or Western diets, can have profoundly negative effects on the gut and on increased neuroinflammation. They recognize that there are limited randomized controlled clinical human studies on this topic and that more needs to be done in this area, and I could not agree more. They suggested that the modified Atkins diet may be effective and more sustainable, especially on cognitive function and anti-inflammatory functions. They found in their review that vegetarian or Mediterranean diets can also be effective in Parkinson's disease. And they concluded that more research is needed with longer trials in humans. So how would I give you some applications for daily life based on my review of this study article? I would say, number one, eliminate processed foods which are high carb, fat, and fructose containing. Focus on the healthy fats. These include coconut oil, butter, avocado oil, lard, and tallow. Your body knows what to do with these fats. Reduce simple carbohydrates and ultra-processed foods to control your glucose and know your individual carbohydrate tolerance. Some people can tolerate 100 grams of carbohydrates per day and still maintain control over their blood sugar levels. Others need a very low carbohydrate approach, less than 5% per day. Keep your proteins moderate, between 15 and 25% of your daily calories. Test your glucose and ketones each morning with ketone glucose meter. I recommend the Keto Mojo meters. They're easy to use and very cost effective. Try to drink water, coffee, or herbal tea only. No sodas, alcohol, or sugary juices. Investigate the use of probiotics and fermented foods like kefir, yogurt, and sauerkraut. If you'd like to view one of my videos on how to make medical-grade probiotics at home, check out my YouTube channel. Try to avoid antibiotics when you can. Limit your use of NSAIDs. These are things like Aleve and ibuprofen. And limit GERD medications. These are things like omeprazole, Nexium, Prevacid, Prilosec. NSAIDs and GERD medications truly change the function of your gut microbiome. And finally, practice intermittent fasting. Start with a 16-8 fast. That means that you fast overnight for 16 hours and your eating window is 8 hours. Maybe moving towards more of a 2 meals a day kind of plan. Maybe once a month, try a 20-hour fast, and that would be 1 meal a day. This is the reference for the article that I reviewed by Aiton and Bellici in 2024, Modulation of Gut Microbiota through Dietary Intervention in Neuroinflammation and Alzheimer's and Parkinson's Disease. Check out the links below in the description. One link will take you to this study article so you can read it for yourself. Another link will be an email address where you can email me if you are interested in participating in my research studies in Parkinson's disease. Once again, thank you for checking out my YouTube channel. I'll see you on the next video.